Yeah, no more Raising Babies 101. We talk about pets and your babies, C-sections, and our yummy mommy for the day, Leanne Manas. All this and more on today's episode of Raising Babies 101. A very beautiful morning to you all, beautiful people. Welcome to another episode of Raising Babies 101, full of insight and entertainment, or all things parents and their babies. Our babies might be cute and cuddly to us, but our pets, they might come across as a threat. So the big question is, should parents prepare their pets in time to meet their children? Joining us today to discuss this is Robin Eshelby, a dog behavioralist, and Lumka Golintete from Claw, and my lovely studio audience. Let me start with you, Robin. Is it important for parents to introduce their new baby to the pets?
It is very important. The dog should always be a member of the family. And the same way you would introduce the baby to its siblings and to its grandparents, it should be introduced to the dog as well.
What's the process?
So there's certain things. So we always need to look at it from the perspective that particularly if the dog hasn't been exposed to children before. Little babies smell interesting, they make interesting sounds, it could be a bit confusing for a dog. So one of the methods you can use is that before you introduce the baby to the dog, you can perhaps use a blanket that you've been using to hold the baby, one that the baby's been sleeping on or feeding on, and you can sort of introduce the scent. Dogs are, as a species, they are based primarily using their nose, their scent, and as such, the best way to introduce them is to let them sniff the item, and then sort of you can cradle your baby, sit with the baby-like approach and sniff the baby. You don't want to put the baby down and let the dog approach. The baby must always be part of you, part of the adult.
Lumka, in some households, people don't allow their dogs inside. And their dogs stay outside in the dog house, and if the dog comes inside, everybody loses it. Like, yo, outside, outside, outside. In that family environment, does the same apply? Because, Robin does touch on the fact that if the dog is not part of the family environment, it's a very different setting.
Okay, that's part of what we do also. We go out and educate people because we told them, how is a dog supposed to protect you when it's outside if you're saying you need protection from it? Because someone can poison it easily if it's outside. So we educate everyone wherever we go that it's easier, it's you protected if the dog is inside with you in the house. So now people are trying to adapt to that. We've been having really good response to that. So we've been educating,
What do you teach your children about interacting with animals?
I think the most important thing is that children need to understand that just like themselves, a dog or a cat or whatever the animal is a sentient being with feelings, with a beating heart. They experience pain the way that we do. They experience sadness the way that we do. So, a lot of children approach a dog as sort of a fluffy toy. They aren't able to correlate the difference between a living creature and sort of a fluffy, inanimate object. So it's important that parents teach their children that a dog mustn't have its tail pulled, it mustn't have fingers stuck in its eye, things like that. You get such different dogs in terms of character, just like humans, they all have different personalities. And what can happen is that one dog will be very tolerant of certain behavior and it will really, really put up with a lot of what the children do. And then you end up with another dog that has a very short fuse and isn't actually able to process what the child is doing. So it's important that dogs have their own space and that they're respected. And it's important that, and likewise, the dog shouldn't be allowed to take food from the child and things like that. So it's good manners both sides. I think that's the most
Robin,
important.
what happens if you've done everything right, you've followed the steps, you've tried to introduce the child, but this dog doesn't want at all?
It's a tough one. It's not something that you can sort of say every dog is going to be the same and every reaction is going to be the same and the outcome is going to be the same. Yeah. If the dog is behaving aggressively towards the child, and by that I mean really looks as though it wants to bite the child, it would be good to get in touch with someone like Claw or one of the community projects who will be able to refer you to someone who can possibly assist. We can't rule out as well that sometimes there are medical reasons that dogs do what they do. So it's good to involve someone like one of the field reps from Claw and have a look over the dog. It could be something simple. one of the very important things that people often don't factor in is choosing the dog according to kind of what your life goals are. And certain breeds are engineered for certain sort of things that they do. And one of those breeds is like the ones used for dog fighting. If you know that your intention is to have a family dog in the home, you'd be best off looking for a real good old-fashioned family dog.
Yeah.
And don't sort of kind of buy above your pay grade. You know, you're going to run into problems like that with that.
All right, let's go into our studio audience and get some questions.
If maybe for the past 13 years you have a wild dog, then the newborn baby abatla in the house, how can you make the child, then the child grows until he's 5. How can you make the child not to be scared of a dog?
Firstly, I'm gonna question him. Like, the dog changes behavior once you keep it away from people. So if it's a dog that's not introduced to anyone, you can't just like after 13 years and then you decide that you want the dog to interact with the baby. You know what I mean? Because you have decided to keep the dog away from being introduced to people. So I think if you're going to keep it like that, rather not, because it takes time for the dog to, unless you try and say, you know what, I'm not going to keep the dog outside anymore. I want the dog inside. Let it be in the family. Let it be part of the family before you start introducing the dog to the babies.
If I can add to that, another thing that can influence it is that if your child has food in his hand, you don't want the child to be standing at, say, you've got a gate there and the dog is this side and the child is this side, holding the food. It's very important that the dog receives good food and good care, that it's not only wanting the food out of the dog's hand, the child's hand. Sorry.
Thank you so much, ladies, for coming to chat to us. Really appreciate that.
Thank you.
Thank you. I remember a few years back when what was known as the baby leash first hit the shelves, and then soon after, the streets. Most people were left questioning if we were turning our children into pets, kapa jwang. But this is for you to decide. So, let's do it. You decide. All right, so my studio audience, what are your thoughts? Are you for a baby leash or no? Vote now. Wow. Not one person for the baby leash. Well, Rilerato are on the streets to find out what you thought about this.
I don't think leashes are good for children. I know it's for safety purposes, but also they minimizing their space of movement, their ability to move around.
Ke nahana gore ha di right because ke nahana gore di senya freedom ya ngwana, like ha be comfortable ha gola.
Nna ke bona e le plan e siameng ka gore bana ba latlhega within a minute le ha o tsamaya le ena motswadi, then ke nagana gore attachment e go e sebetsa hantle because o tlo kgona go bona gore ngwana ha o teng gaufi le wena ka nako tso tsotlhe.
Ha ka se latlhe ke responsibility ha o le motswadi gore ngwana ha o a dula le pela ha o ka mehla.
Joining us in studio is Catherine Cresswell, a clinical psychologist, to chat baby leashes and harnesses. Welcome, Catherine.
Thank you.
So, Catherine, tell us, I mean, baby leashes are quite scary looking things.
Yeah, I think it's because of the association with them being used on dogs. And people are quite happy to keep their dogs really safe on leashes, but can feel really victimized by society when they want to keep their child safe on a leash. So I personally use the word harness.
Okay.
But yeah, I think it's really can be a safety issue for parents. But people are very quick to judge.
Yes, people are very quick to judge. So what instances would a parent resort to using a harness on a toddler?
It can actually be better from a physical development point of view to have a child not with their arm like raised up all the time and clinging to mom. In fact, we want to encourage them to explore and to look at this leaf or that flower or whatever's going on in the streets, but we don't want them mowed down by a car. So it can be really helpful for a mom who's a bit stressed and anxious already to have their child safely on a harness that's not doing any physical injury.
So you do mention the safety aspect of it, but could one also say that it's a way for the parents to control?
Absolutely, and parents should be in control. We forget that, in fact, that's often a parent's role, is to teach the child boundaries and to teach a child a sense of safety in the world.
What is the best age to introduce it?
Well, you're really looking at when they're starting to walk and in that sort of 2-year-old phase where they're not very verbal yet, they're learning to speak. It might be the most useful thing just to have a clear and consistent rule. But by the time they're 3-4 years old, they can understand you enough to know that they have to walk next to you.
And are there different types of harnesses?
The most common are they kind of strap across the chest, and then you have a little holder so it's quite comfortable for the child. They barely notice it.
Also, I have to ask you, I mean, for a parent who's looking on, automatically you assume that when you see a child with a harness, that this is a badly behaved child or an uncontrollable child. What is the stigma and how do you break them?
I think it's so difficult for parents. Any parenting decision you make can get all kinds of hate from people looking on who are not in your situation. And I think it's really up to us, and that's why I appreciate this kind of program, to actually reduce that stigma because parents are doing the best that they can.
Well, thank you so much, Catherine. Appreciate
That's
your time
my
on this
pleasure.
one.
Thank you.
Okay, so at the end of the day, it's about safety and also about control for you as a parent. But that's why we call this segment You Decide, because the choice at the end is yours. Any questions or tips or tricks you might have, Kochai, please share them le rona on our social media platforms. Look for Raising Babies 101 on Twitter, Instagram, Facebook, Lemo, YouTube. We'll be right back. Hariboa, we've got tips on choosing a hospital for mummies giving birth. Then later, we are joined by Yummy Mummy, Leanne Manas. Raising Babies 101 iatswela pele yanong, and now we are tackling how to develop your child's language skills. This is easy peasy. I'm joined by Farron Schneiderman, who is an educational psychologist and play therapist, as well as Samantha Smith, a speech therapist. Welcome, ladies.
Thank you.
So what do we have here?
So this is a really great tool for developing language skills for your primary school and even your preschool learners, as well as literacy skills. It's called a word web. And we've drawn the spider web to concretize for the child that every word in language is connected in some way or another. So I'm going to work through it with you so we can show parents how to use it at home.
All right.
So first of all, obviously you draw your web, and then in the middle of your web you put the key word that we're going to be building off, okay. Which is bat. So now I'm going to ask you, can you think of, for me, of words that rhyme with bat?
Cat.
Okay, great.
And what age would this be doing? You be doing this with what age?
So we would be doing it from about, you could do it from about 4.5 to 5 and upwards.
Okay.
But it's a great tool for, for children to learn literacy and language.
Okay.
Okay.
All right.
Can you think of any other words?
Mat.
Okay, great. So we would build up from there and we think about all these words that rhyme. Making children aware of rhyme patterns is really important. It's an emerging literacy skill. So you would write it as the parent. Then we build off from the word bat. So then I would ask you, what do you think of, Carol, when you think of the word bat? What is a bat?
Okay, it's a type of bird.
Okay. An animal.
Animal.
Yes. What does it look like?
It's black.
Good. And where do bats live?
In caves.
Good. And the bat comes out at night. What do we call an animal that only comes out at night?
Nocturnal.
Good job. Can you think of any other animals that are nocturnal?
Wow. A mole? I don't know if it is nocturnal. But there we go. So you build like that, you keep going.
100%. So you're building off and you're building those connections. We're building word associations between words till we get a really nice full word web. Then we move from there and we move to the outskirts of our web. And this is where we start to teach children that words have multiple meanings. So bat can be bat, the animal. Can we think of any other meanings for bat?
Okay, like a bat, like a baseball bat?
100%. A cricket bat. So bat, the actual noun, and the cricket bat. Bat like you hit the ball, you bat the ball.
Yes.
And even we could say that bat like when a girl gets very shy and she wants to bat her eyelids to sort of look good for the boys. So you can see by doing this activity, we've done a whole lot of different skills.
True.
We've built cognitive pathways and we've built the foundations for good emerging literacy later on.
All right. So tell me, Farron, from the as an expert with regards to how play therapy is important, how does this help children?
So in terms of play therapy, I think you can introduce this in terms of play therapy if it's a specific area that needs development.
Yeah.
But I think just to add in terms of learning difficulties, there's a large array of learning difficulties, but the parents' involvement is so important because if parents can assist them with the children, I know most parents are busy and don't have time,
yes,
but even if it's just for a few minutes in each day or once a week, it will help them to develop from a young age, and it will help to prevent them from getting worse and the gaps getting bigger in learning difficulties.
Why is cognitive learning so important?
Well, often you find, I think, that children who've got learning problems, they often have difficulties in certain cognitive areas. So that being language, often literacy, possibly attention. So this is why this is such a lovely activity, because you can sit down with your child for 15 to 20 minutes and build those skills with not much cost, a piece of paper and a pen. And you can do an activity that's targeting a number of different cognitive processes at the same time.
And just to add to that, it's also spending quality time with your child. So as much as your child might hate this, you can make it a fun activity and like a game for your child and introduce it as a time where you can get to know your child. And through this, you can even ask questions about how their school day was, did anything exciting happen, and build their language, but also build your connection with your child.
100%. Okay, so what do you do if you have a child that has a learning disability, for example, ADHD?
Well, I think the first port of call is to go and seek a professional. So someone like Farron would be an educational psychologist, would be able to assess and see where the child's sitting developmentally and to identify whether the child does have ADHD or not. Not everybody can diagnose that.
Yes.
And then once you've identified where the key areas are that need to be addressed, going to the relevant professionals to seek assistance in that regard.
Okay. And do you have anything to add about that as well,
Yes,
Farron?
I think also just, I think there's different difficulties. They come across differently in different classrooms, and sometimes people will say your child's got ADHD, and really it's more of an emotional and an anxiety. So it's always good to get a holistic assessment. So to look at the emotions, to look at the cognitive ability, to look at the speech and language development, to look at the gross motor development and fine motor development, and just to get a full picture.
Well, thank you so much, ladies. Appreciate that. It's amazing how a spider web can teach our children. We love it. Thank you. From bats, it's now time to give away prizes in our baby shower. Okay, Mubugedi, as you have seen, Huhudi Sabana can be a very, very costly affair. To make life a little easier for you, segment ena ya baby shower, ke go go thusa ka tsone dimpho. This week, we have a baby hamper voucher to give away. All you need to do is answer yes or no to one very simple question correctly. Is it important to develop your child's language skills at an early age? To enter this competition, where now set when it's answer this question yes or no on social media platforms. Answer correctly, and one lucky viewer will randomly be selected to win a baby hamper voucher valued at 1,000 Rand. The winner will be announced on our social media. Best of luck. Hariboa, we discussed choosing a hospital to give birth in. And later, in Baby's Health A to Z, we hear what word our letter C decodes. And then, our yummy mummy, Leanne Manas, comes to visit. Stay with us, don't go anywhere. Welcome back to Raising Babies 101. Lenaneho la lona bomme le bontate ko gae. We connect with various experts and discuss various issues. Today, though, the big question is, how do you choose where to give birth?
Hi, Raising Babies. My name is Pumzile Ramusi. I'm pregnant with my first child, and now I'm still trying to decide where I should have my first child, and for a C-section or natural birth. So, Raising Babies, please help me.
Dr. Uviwe Betsa, a gynecologist, joins us to chat about this. Welcome, doctor.
Welcome, Carol. It's good to be here as well. Yes, okay. Yes.
Awesome. Yanong, how does an expectant couple decide gore ba tlo pepela ko kae?
Yeah, so basically, when the couple is pregnant, expecting, Mo ba pepelang teng who important haholo, because this is where they're going to end up with their bundle of joy. So it is very important that they choose carefully. I-medical aid yakho ithi uya kwesiphi isibhedlela kuqala. So your medical aid plan or option might actually say you need to go to a certain hospital than another hospital, because there's these groups now that, you know, medical aid A or B says you must go to a particular hospital. So you need to first check ba kwesiphi isibhedlela ba buye kuso. Okwesibini funeka uyaba unabahlobo na abaziyo kwesasibhedlela kwaye wakhe waya na uve ntoni kwesasibhedlela. What have you heard? What is your expectation where you need to be there? So those are the things that you need to first check ba kwenzeka ntoni kwesasibhedlela, ndivumelekile ba ndikwazi ukuya kuso. How far is it to your place where you stay or where you work? Because kulapho uza khona every time for i-checkups zakho. Sometimes funeka uyaba kufutshana kangakanani xa ulunywa. When you're in labor, how close it is to the hospital. Is there transport available to the hospital? Into ezinjalo ke.
You did speak about batho ba nang le medical aid. For batho ba senang yone ba berekisang the public health system, does the same things apply for bone?
Yeah, so libona, if you stay in a particular place, already kukho i-clinic ozaya kuyo efutshana kuyo. La clinic there, that clinic will tell you where to go. So uyayazi, you can't just uba uhlala kwindawo ethile awukwazi uya kwindawo ethile ba i-clinic ba apha kuyiwa sibenzisana nesibhedlela. So every health center is linked to a certain hospital. So there's primary, secondary, and tertiary. So wherever you are, your clinic will tell you, we send you to this hospital. So that's where you're going to deliver the baby. So it's been chosen, the path has been chosen for you, even in the public sector.
So it's important gore on all sides u check pele before gore o itse gore does this medical facility e ke itlhophileng, does it actually give me the facilities?
So clinic, they will tell you gore when you're in labor, we are kokai. So even from health education point of view, you are being told this is your facility, and then you can go and check a facility so that you can get comfortable with it. All those things.
If you have high-risk pregnancy?
High-risk pregnancy, you won't deliver at the clinic, you'll deliver depending on how bad your high blood pressure is. So, for example, if how uncontrolled or anything else, then now you go to a level 3 where there are specialists on that hospital.
What would you say are the do's and don'ts?
Well, you need to be aware about you are going to go to a certain facility. What does the facility offer you? And if you cannot get there, how close? Because you can get to another hospital which is close by if you were traveling and then something happens, and then you can go to any. They will assess you there and then refer you appropriately. So you need to know that you're not obliged to go to a particular center just because you were told and then you happen to be closer to hospital A.
And if usena chelete and you want to do home birth?
Home births can be done, but we in this country we try to encourage hospital births because of the complication that can happen at home. That needs to be arranged prior. You can't just decide I'm going to deliver at home without anyone. There must still be someone experienced who will assist you even in that regard.
Right. Thank you so much, Doctor, for your insights. We really appreciate it.
Thank you, Carol. Good.
Oh, good. So it seems horeki research, and more research. Yanong uhupule horokare tola mo social media. That's Raising Babies 101 mo Twitter, Facebook, YouTube, as well as Instagram. We'll be back after this. Morago ga dipapatso, we decode the letter C for Cesarean section. Welcome back to Raising Babies 101. It's time for Babies Health A to Z, and today we're looking at the letter C for Cesarean section birth. A Cesarean section is delivery of a baby through a surgical incision in the mother's abdomen and uterus. In some circumstances, a C-section is scheduled in advance. In others, the surgery is needed due to an unforeseen complication. If you or your baby is in imminent danger, you'll have an emergency C-section. Otherwise, it's called an unplanned section. Gynecologist Dr. Uviwe Pitsa is here to help us understand. So let's talk about your cesarean section. It's become more and more popular, a more and more popular birth. And I know there's different schools of thoughts on natural births versus cesarean section. What are the reasons that a woman would have to have a Caesar?
So firstly, there was natural births first, but because some of the complications happened that made people to think, but let's do something else now, because babies sometimes cannot be born naturally. So cesarean section was birthed because of that, for some reason that if someone goes naturally, sometimes things can happen. Like so the fetus, the baby, could be in distress. What do you mean about that? Sometimes ingane actually oxygen. So the fetal heart rate, yehle, and if you don't deliver that baby sooner, that baby won't make it. So sometimes a cord is around the neck, strangling the baby, kind of. Okay, sometimes the baby does number 2, called meconium, and the risk there is that umntwana can drink that fluid and get sick. So such things make us to take the baby and save the baby and do a cesarean section. So there are problems with the baby. There can be problems with the placenta. The placenta, it's what connects the mother and the baby. Sometimes the placenta can bleed or can be separated, called abruptio, or can be in the lower segment. It can be on the way. It can be obstructing the birth canal. And as the mouth of the womb opens up, the bleeding can happen. So such things makes us to save the baby, to do cesarean section. There could be also problems like the mother herself. So the mother, if the mother is sick, she has got conditions like high blood pressure, cardiac conditions where labor can put a strain. So that mother will have to go for cesarean section. If her womb was opened for whatever reason, that womb will be at risk of rupture, so we'll do a cesarean section there. So there's many other reasons. It could be that the mother's pelvis is so narrow that the mother won't be able to push, or the baby is too big. The baby can be too big to push, so no matter how much you try, so that baby will not come up, so that mother will have an emergency cesarean section.
Is it true that women with smaller feet are more prone to a cesarean section? Because I've heard doctors ask, what size shoe do you wear?
So, yeah, there is a correlation between a shoe size and the pelvis size. So if you are small size, maybe size 2 or 3, you are most likely to have a smaller pelvis. In that way, you know, you're unlikely to deliver naturally, you know, so cesarean section would be a better option for umntu. Yeah.
So the bigger your foot, the better?
The better, and also...
So if you wear a size 10, good to go.
Yeah. And also the size of the baby, of course. Normal birth weight is 2.5 to 3.5. So if your baby is 4 kilograms, you know, the chances that, you know, you probably won't be able to deliver naturally. Yes.
So how is cesarean, how is it done?
So if it's an emergency cesarean section, it must be done as soon as possible. So the mother will have to get prepared, put up a drip, and all the consent papers. And then in theatre, we'll go to theatre, there will be an anesthesiologist, Dr. Lona Oza Mlalisa, basically. Amjova Pemkolo, Kuti Angazoluto from the chest up to the legs. And then we cut on the lower segment, just above the bikini line, and then we deliver the baby from the uterine scar. Yes. And it takes about 5 minutes for the baby to come out after we've started cutting.
And how long is the whole process?
The whole process is 45 to an hour. Yeah.
I've also heard a school of thought, but doctor opta for these cesarean sections because they are quicker and a doctor's able to deliver bana ba bangata in one day. So it's sort of like a way for doctors. What do you say about that?
It's not like that. We are safe doctors, so safety first, because, you know, whenever natural is actually sometimes dangerous because you don't have the control over it. So things can happen that are not in your control, you know, and the baby can get stuck there and lack oxygen. So we always play it safe. Whenever there's a problem, there's a delay or poor progress, or the baby's in danger, we'll opt for cesarean section because that's a safer option. And we know that a mother comes to us because they want a healthy baby. So if you come to me, I want you to take home a healthy baby. So your pushing sometimes might be overridden by that aspect that, you know what, I'd rather have you taking a healthy baby than you taking a boy baby. You push under any circumstances and then things don't go well because then you're going to have a baby that is brain dead or brain damaged or whatever case might be, and that won't be a nice thing, but that's why we prefer to be safer, and now we are moving towards that direction that the safer, the better.
Can it be harmful?
It can be.
To the child?
It can be, not to the child, yeah, to the child as well, but mainly to the mother. So when we do Cesarean, we do it for the baby. And, you know, there are complications to the mother because it's an operation. You could bleed and need blood transfusion. You could have an infection on the wound. You could have damage to bladder or accidentally, but those things are rare. You know, with more skills that we have in this country, those complications are seldom seen unless it's someone who is unskillful, but even then, they need to be supervised. But under normal circumstances, it's pretty safe compared to natural sometimes.
I've also heard Horobana that are born via Cesarean section. Breastfeeding might be different for them. Is this a myth?
That's a myth because even with a Caesar, you can bond with the baby immediately. Sometimes we give the mother the baby while we're still busy in theatre, but the mother can still hold the baby skin to skin and even breastfeed sometimes. So the bonding is actually as quick as possible as in natural sometimes. Sometimes in natural, you're so tired that you don't want to do anything with the baby. You know, it's like, you know what, you know, so yes, yeah.
I hear you. Let's go to our studio audience for Potso.
Sanibonani. Ninjani? Mina bengisacela ukubuza doctor placenta mayisuka ibleeder isuka ibleediswa yini and mayibleeder umntana usafe kangakanani?
Sometimes kuba khona conditions like xa umama high blood pressure iye affect umama ingane neplacenta. So my placenta igula ingaqabuka okanye iqhawuke. Mayiqhawuka umntana usengozini because umntana akafumani oxygen ke ngoku, so funeka ubalekiswe wenze uba awuyenza ngesiza la mntana akazuphila. So yenze loo nto xa umama echaya okanye high blood pressure okanye nje ewile, xa uwile and then ungawa ulimaze iplacenta imoshakale and then umntana ophe.
I know in the past there was a lot of talk around where there's a limit. Hanali C-section, May can only have 3 babies. Hanali C-section or Hanali C-section. If I change my mind, natural birth. Are these myths, misconceptions?
No, they're not misconceptions. But what we know is that once you have one Caesar, you can have natural. It's called VBAC, vaginal birth after cesarean section. So although the risk is there, but the risk is acceptable in terms of we allowing you to die. But once you have 2 Caesars, then you'll always have cesarean section because the risk is too high.
So how many? You
can have safely 3, but in good hands, you can even have 4 or 5. You know, it depends which facility you are in. The more Caesars, the more riskier to you.
So at the end of the day, you've heard from the doc, it's all about what's best and safe for your baby. Stick around, don't go anywhere. Raising Babies 101, Iabua after this. Sesilatelang, we sit down, Leanne Manas, and we talk parenting. Welcome back to Raising Babies 101. She's been in our living rooms every morning and having breakfast with many South Africans for almost 15 years. So I'm going to jump straight into it and welcome the yummy mummy, fabulous Morning Live's Mrs. Leanne Manas. Welcome.
Carol, good morning.
Good morning to you, Leanne.
Thank you. Thank you so much for having me.
Now, I know it must be quite interesting for you because you wake up at a very early time in the morning and you're a mom. How do you do that? Because I know from doing early morning shifts that you're tired by like 9 o'clock, you're done.
You're done. You really are. You know, that's the problem. But I suppose there's one advantage is that I'm not necessarily there for that morning rush. Yes. You know, the morning rush where you've got to get the kids out of bed, get them ready for school, pack the lunches. force them to wake up, get them dressed and out the door.
Yes.
So I am not there for that.
Okay.
And it's good and it's bad. It's bad for me because I miss out on that, but it's good because I don't go through the frustration. So I have the most unbelievable lady who lives with me and works for me. And she's like their second mother, and she's got it mastered. So, yeah, besides everything else, that's that one section that I miss with them. It's just that very early morning shift.
Yes, I was going to ask you, do you somehow feel some sort of void missing that early morning rush that moms always complain about?
I don't think it's a void. No, I think I've got a lot of mothers who are jealous of me, thinking that I don't have to do that. So I think I'm very lucky that I missed that part of it. You know, I'm with them for the rest of the day, which is so nice. I get to pick them up from school, do their sporting activities, sit down and do homework with them and cook. And so that's the nice part. It's just that little bit that I do miss.
So I know your kids are 8 and 5, is that correct?
Yeah.
So what are their names? What kind of personality do they have? Do they want to be TV stars? No, I don't think they do. They've never mentioned it to me. In fact, I think they're just sort of beginning to realize what I do for a living, and it really doesn't impress them. So it's quite nice. So the boy, Alexandro, is the oldest one, and he's a gentle little soul. He's a good boy. He's the kind of kid you tell him to do something and he actually does it. Oh, lovely.
He's sweet, he's gentle, he's really adorable. Then there is my fiery Gabriella, who is 5 years old, and she is unfortunately a remake of me, but a remake of me much later on in life when I'd built up confidence already and I was just rearing to go in life. That's her now at 5, so I don't even want to know where she's going to be later on, but she's the go-getter, very, very smart one. So they're a great mix, and they're good for each other because they seem to bring out the best in each other, which is really nice.
Yeah. You did mention that you tend to take your kids for activities at school and stuff. Are there any specific play things that you do with your kids at home that encourage some sort of communication between you and your kids?
I must say, I love just being with them. Reading is a big thing, and that's why when I was looking at the shelf behind you, I was sort of recognizing 1 or 2 of the books that I've already got for them, because they love that. They really love that. Colouring in, making puzzles, just being together, I must say, is something so special for them. These are very precious years that I find myself in. I'm loving it at the moment.
Oh, that's amazing.
Yeah.
We were chatting earlier on the show about animals and pets with your children, introducing them to pets and so on. Do you have pets in the home? How's that relationship with your kids?
We have, and you know, in the beginning I was a little bit worried, as new parents are, because we'd had, my husband and I, and again, I think a lot of parents or parents-to-be will understand this. We thought, we're going to get a dog, and if we keep the dog alive and we do a really good job with the dog, then we're going to have children.
Yes.
I've heard a few parents and new parents saying that. So we had 2 dogs before we had the kids, and I was a little bit concerned as to how that relationship was going to work. But, you know, my kids have grown up. So from the first day back from hospital, both of them, we've had 2 dogs. They've grown together, and it is amazing. In fact, one of my dogs, the little boy, he used to sit when I was pregnant with Gabriella. He would sit on my lap, and he would just put his head on my stomach. And he would just sit there, and I would just feel Gabby kicking. And it was the most dynamic feeling. It was absolutely beautiful. So I think pets and babies are a great thing. They really, really are.
Yes. We also spoke earlier on in the show about hospitals and choosing the right hospital, and so have you. With regards to, I don't know if you're comfortable to speak about it, but with your birthing, did you go with a home birth, hospital birth?
Hospital. I was in hospital. I've sort of, you know, when it comes to the birthing plan, and I think it's something I imagine you've discussed quite a lot on the show, is that, you know, every mother has her wish of wanting it to go a certain way. And it doesn't always work out that way. In fact, 90% of the time, it doesn't work out that way. So you always got to prepare your mind for the fact that things are going to change. And that's exactly what happened with me. You know, I was hoping for a natural birth. It didn't work out that way. I had a cesarean, but I was in hospital. I was always going to, you know, give birth in a hospital, you know, with all medical care around me. That was the way that it was. So yeah, I mean, I felt that the hospital that I was at was exactly what I wanted. We did our checks beforehand. We saw where it was. You know, I felt really comfortable with my doctor, and it was all, you know, it went the way that I was hoping, to the best possible way.
Okay.
Yeah.
And who's stricter, you or hubby?
Hubby.
Yeah.
Fact. You know, you'd think I'd be the strict one,
Yeah.
but I'm not. I have a loud voice, and when I shout, it can be very big and loud. I just don't. I unfortunately, I'm the walkover, and it's terrible. It's going to change though,
Yeah.
because they're going to start pushing the wrong buttons.
Sure.
But at the moment, no. The husband is much stricter than I am. In fact, he's the one who says to me, "Now come now, please. Can we just, you know, surely you've got to be shouting more." I'm like, "Okay, it's coming. It's coming. Don't you worry. There are going to be lots of fights ahead."
So where do you not compromise?
You know what? With my kids, I hate lying. This is the one thing, and my kids know that, is that I want you to tell me the truth. I don't care the time they've ever heard me shouting is if they come and make up a story to me and it's an absolute lie. That's when I get cross. So there is my big thing. I want my kids to not lie. I want them to say hello to other people. I want them to have respect and be well-mannered. Those, for me, at this age, these are the big things for me. I want to instill in them those little morals and foundations that I had drilled into me when I was a kid, and things that I still carry on in my life now. So had it not been for my parents being very strict on certain things, you know, I don't think I would be who I am today. And the reality is I want to bring those same things and characteristics into my kids. So it's just your moral fiber. I want them to have good morals. I want to bring them up in a way that that they're humble in who they are, and they respect people. Because if you don't respect people, then I just think your path in life is going to be a lot more difficult. So these are the kind of things that I want my kids to have, and those are non-negotiable to me.
Non-negotiable.
Yeah.
Well, let's go through to our studio audience. We got a question coming through from them.
Good morning, Leanne. How are you?
I'm fine, thank you. How are you?
What I would like to know is how do you keep up? Because I know that you wake up very early in the morning to go to studio. So how do you keep up with your kids? Where do you get all the time?
You know, I've got so much help. And I've often said that I've got an amazing mother, an amazing mother-in-law, an amazing husband, and an amazing helper who lives with me and is like a second mother to my children. If it wasn't for this backbone and the help that I have, I'd never be able to do what I do. And I often thank them, and I often tell them, you know, I'm living my dream because of you. I would have had to have stopped doing what I do and living my life a long time ago. So thanks to them, and that's a big thing for mothers and for parents. Sometimes when you have your kid for the first time, you almost feel like you don't want to. You want to be in control of every single situation in your child's life, and you never want to ask for help, and you never want to rely on anyone else. But if you want to, you know, if you also need to still be a person. So ask for help. Don't be shy to do that. It's an important part. You need to still have that little bit of freedom for yourself and grow yourself, because you can become very boring and lost in the world if you're living through your child's eyes the whole time. Yeah.
Thank you so much for that question.
Pleasure.
What is the best advice you've ever gotten as a mom, and what advice would you impart on our wonderful viewers?
The best advice that I've gotten, you know, when you're pregnant, you get advice from everybody. When you have children, you get even more advice of how to bring up your children. Yeah. So the advice never, ever stops coming in. But I think one of the pearls of wisdom is that every child is different, and every child needs different things. And I was always worried when I had my first kid. I thought, I adore this child. I love this child so much. How am I going to love another child? And I remember it was my husband's gran who turned to me. She's called Yaya. It's the Greek version of gran. So Yaya turned to me and she says, "Don't worry about that. It's not that you're not going to fit the other child into your heart. All that's going to happen is you're going to grow another heart for this child." And that is the truth. That is the one little bit of truth that I can account for, is the fact that it doesn't matter how many children you have, you love them equally, and they can do no wrong in your eyes. It's changed me as a person. And I didn't understand that when people would tell me that by having children, you're going to change. And I didn't know how, but I did, and for the better. So I hope that, you know, people that are thinking of having kids and are ready for them realize that you become such a beautiful person because of these children, and it's a great thing.
That's beautiful. Thank you so much, Leanne, for coming in and chatting to us about that. Really appreciate
Absolute
it.
pleasure. Thanks for having me.
Yeah, I love it. So you can grow another heart. It's really nice to hear that because I have one boy and I plan to have many more. So thank you so much. From me, Carol Lavore, it's been a wonderful show. Thank you so much for tuning in. And leska lebala. Hara tlhokomele bana ba rona. Nkare bana ba rona ke bokamoso ba rona. Until next week. Bye-bye. Welcome to Pep Talk, the parent's guide to raising your babies. Once you have figured out a birth plan and have chosen a hospital where you'll give birth, you can now start preparing for your baby's arrival. I'll be taking you through some wardrobe essentials for newborns. There is nothing cuter than tiny baby clothes, but moms and dads will want to pick out practical items that will keep baby comfy and cozy. When it comes to clothing, these are the baby must-haves. Onesies with wide head openings with snaps. A few undershirts and vests. 2 blankets or swaddle cloths. These are only some of the options on offer. It's easy to get carried away when buying clothes for your newborn. Remember that they are likely to outgrow these by 3 months of age, so buy only what you need. Also consider how easy garments are to put on and take off. For your newborn's wardrobe, you'll also need the following: a dress-up outfit for when baby goes home, booties that you can use as mittens. You can also get a cute hat to keep your little one's head and ears warm. Share your cutest baby wardrobe essentials on our social media pages by using #PepTalk. To get winning with Pep, get onto our social media pages and enter our weekly competition. You'll stand a chance to win some great prizes. Thank you for watching Pep Talk. Join us again next time, same place.